Hi everyone, my name is Bukare. I am working with WHO Regional Office for Africa in Congo, in Brazzaville. And from here, with the whole training team, we are sending you our greetings and a very warm welcome to this panel. I'm also passing you the greetings and regards from our Regional Emergency Director, Dr. Salam. It is a real pleasure for me to represent WHO AFRO in this panel. I am excited, I am happy to share our working experience with ECHO. My presentation is going to focus on two aspects. The first aspect is I will share with you how WHO AFRO was able to quickly leverage the ECHO facilities and the webinar platform to broaden the scope and the coverage, to broaden the reach of our virtual learning activities and efforts. And this was done right from the early phase of the pandemic in 2019-2020. I will also explain how we were unable by ECHO to disseminate critical information to healthcare providers and public health officials. I will also show you how we were facilitated and supported by ECHO to share best practices, to democratize knowledge, and most importantly, to save lives. This is the first aspect. The second aspect, I will present how the EPR training program has evolved so far, how we have matured so far, and how we have progressed, and our perspective. So, please, stay focused, stay concentrated, and stay with us. Listen, in time of crisis, there are always opportunities, and the COVID pandemic has been one of them. The COVID pandemic is a good example of opportunities for learning and training for us. This pandemic plays on WHO AFRO a huge and new demands for information and training. Let me put it simple. When COVID-19 started in late 2019, early 2020, the member states in Africa, in AFRO region, were really looking for correct information about this new disease. And at that time, WHO was seen as the only credible voice and the only reliable source of information for them. The public health and social measure that drastically reduce ability and possibility to conduct face-to-face training. So, the bigger driver, the trigger for our work has come from this pandemic, which has negatively impacted on the mobility. Consequently, WHO was required to use digital learning tools to address training needs and strengthen the workforce capacity. It was in this context that we reached out to ECHO, the UNM, to serve as a catalyst for this digital transformation, given that Project ECHO already had a long history in evidence-based model of learning of health workers and peer-to-peer learning and education. Together with ECHO, we have launched and we have conducted different virtual learning and dialogue series targeting health professionals across Africa, across all disciplines, across all occupations, and all levels of the health sector. and health system. As you can see on this slide, with support from ECHO, we were able to reach out up to more than 120,000 participants, 120,000 individual attendees. And you can see on this table the breakdown by year. So we have conducted, with support from ECHO, almost 300 events. I mean 300 webinars and meetings. And we have involved over 600 panelists, 600 subject matter experts to conduct these webinars and these meetings. To be able to conduct this, we have devoted around 500 hours of session and over 800 planning hours. This planning time was done between WHO team and ECHO team and the experts. I put down, just for your idea, our session was done in English with interpretation in French and Portuguese. And we have involved over 1,000 interpreters. And for each session, we would spend around $1,500 for the interpretation costs. So, to be able to do that, WHO AFRO leverage its convening role and power to create space for dialogue, to create space for peer-to-peer experience sharing, and to create space for collaborative problem solving. On the other hand, ECHO brought a decade-long experience on case-based learning. ECHO brought the quality improvement approach, and also the support for data collection, the support for monitoring and evaluation. Here, we wanted to show our coverage in terms of geographical. We have reached over 166 countries. In terms of gender distribution, 60% men and 40% female. But as you can see on the map, with support from ECHO, we have gone beyond Africa. We have reached out to the whole world. You can see almost 90% of our attendees was from the African continent, but we have also reached to many in the American continent, mainly from the US and from Canada. We also reached out to Europe, to Asia, to Oceania. Here, we wanted to show the distribution over time of our activity. From the start, around April 2020, until now, we have permanently, continuously organized webinars and meetings with the support from ECHO. And you have some peaks. Towards the end of 2020, you can see that there were some peaks, and also in June 2021. This corresponds to when we conducted the dissemination of the Integrated Disease Surveillance and Response, the third edition of RDSR guideline, when, with the support from ECHO, we were able to adapt a 7 days face-to-face training into a virtual learning, virtual training for healthcare workers. We also put in place virtual community of practice on surveillance. We have a regional community of practice and a country community of practice. And this was done with support from ECHO. Here, we wanted to show that with the support from ECHO, we are working with Africa CDC to implement a program, a joint initiative that we call AVOC Search. For the moment, we have targeted 16 countries. And in this country, we are setting up digital learning platform for the continuous training and learning of a healthcare professional. Here, we just put some examples for you to see: Mauritania, Niger, Togo, Botswana, But we have other countries like Chad and other, where we are installing, we are setting up the digital learning system with the support from ECHO and also the support from the INSP, Institut National de Santé Publique de Côte d'Ivoire. Here we have done some analysis just to show that we are aware of some limitation to consider and some aspect to mitigate. We also know the strength and opportunity given by the virtual learning. But what is important, the key, is to adapt the strategy, the learning approach. We need to adapt each strategy, each approach, and the technology wisely in conjunction with other training methods to create an effective learning environment. So, as we continue to work and to conduct training and capacity building, as the COVID-19 response is winding down, we continue to use the ECHO approach as a legacy. And we continue to focus on smaller and more interactive sessions through virtual community of practice. We are using now an hybrid approach to training session. Some sessions we conducted virtually, and part of the session we conducted face-to-face. So regarding our perspective and the future direction, we consider the work and the collaboration with ECHO as a legacy. And as the COVID-19 response is winding down, we continue to use the ECHO approach to democratize knowledge and best practice through smaller and more interactive sessions, through hybrid approach to training session. We mean that for some training session, we conduct virtual face-to-face and also a face-to-face phase of the training. We combine both to maximize the value for money and to reduce costs. We create multi-directional exchange, and we continue to share WHO guideline best practice. So for the future and for conclusion, we can say that we continue to build our strong partnership with ECHO by providing public health leaders and frontline health workers with equitable access to life-saving knowledge and best practice. So before I end my presentation, I would like to really give a big thanks to the ECHO team, Professor Bruce and his team, Yuta, Connie, Alphonse, Dr. Bikinezi. We really appreciate the support that you have provided to us. Professor Bruce, we appreciate you. We appreciate your patience and your professionalism. I want also to take opportunity to thank the Institut National de Santé Publique de Côte d'Ivoire, Professor Yavo and his team. Thanks a lot for the support. We organized together a regional workshop in Grand Bassam in Côte d'Ivoire, and it was a success. And I think we should continue working together. And I would like to especially thank ECHO India. ECHO India team deserve a special thank and a special recognition for the support they have provided to WHO AFRO. There is 5 hours difference between Brazzaville and India, and sometimes we conduct training very late for them. So I would like to really recognize and appreciate their dedication and the support they have provided to us. Thank you, and over to you.